This question anyone can answer. What is the chance that I might get the swine flu at my office, the work setting? Any volunteers to take this one?
I will say that at the hospital wound center, a number of our nurses have come down with the swine flu. I think that plus some of the volunteers at the neighborhood clinic getting it pushed me over the edge to take the shot, which I was a little worried about taking, but I have had no ill effects from it that I could tell. I think that if somebody is actively sick and shows up at work when they shouldn't be with a fever, they are contagious, they are aerosolizing the air, and unless you walked around with an H1N1 mask, you probably can't protect yourself well. Again, the New England Journal just this week had a article in the front of the magazine that the plain surgical mask probably does little to stop the patient from spreading the illness or prevent the caregiver from contracting the illness. But the H1N1, which is not only makes you look more like Donald Duck, but is actually hard to work in because you have to suck to breathe air in. You actually have to work to breathe, and it's a little harder to communicate, especially if you're communicating like I am in frightening Spanish to patients who don't speak any English at the clinic. It's very difficult to do, so I sort of went back to the plain surgical mask, but the N95 mask is probably far more protective, but they're hard to work in.